This is Moms Every Day, making life easier for moms everywhere, every day.
Hi, I'm here with Dr. Teresa Krause at St Joseph Pediatric Clinic in College Station, and today we're talking about sunscreen precautions. Okay, Dr. Krause, how do I choose the right sunscreen for my child?
Well, when choosing a sunscreen, you want to pick one that's broad spectrum, and that means that it covers both UVA and UVB rays.
Okay.
So when picking a sunscreen, you need to look one that has an SPF factor of 15. So that means sun protection factor, and that tells us about the UVB protection. And then there's also UVA protection, and the ratings for that are stars. So 1 star is low protection, 4 stars means high protection. The other thing is that when you pick a sunscreen for those sensitive areas like cheeks, nose, tops of ears, and your shoulders that get the extra sun, you could pick something that has a thicker agent in it like zinc oxide or titanium dioxide. And then the thing to think about in infants, babies under the age of 6 months, is that little sunscreen as possible. Really need to try to keep those young children out of direct sunlight. They need to be in the shade. If they have to be out in the light, they need to wear a hat with a brim and wear protective clothing. If you need to put a little bit on them, just a little bit on the back of their hands or on their cheeks.
But after 6 months, you can listen to your guidelines and follow those.
Right, you need to cover all exposed skin.
Okay. Okay, what about getting the most out of application? How do I apply sunscreen correctly on my child?
Most important thing is it needs to be applied 15 to 30 minutes beforehand, before you go out in the sun, so it gets a chance to dry on the skin, and then you need to repeat in 2 hours.
Okay, really, really good information, especially with our Texas heat right now. So I really thank you, Dr. Krause. If you need more information, log on to momseveryday.com/BCS.